Dear friends, today is 1st August, and we know this 1st August since 2012, World Lung Cancer Day has been celebrated to mark awareness about the causes, symptoms, prevention, and diagnosis of cancer across the world. The day also urges people to get their screenings done for early diagnosis and treatment. Why we are bothered about this lung cancer? Because according to WHO, this is so prevalent in this world. Yearly more people die from lung cancer than from colon, breast, and liver cancers combined. So this is the leading cause of cancer-related deaths worldwide. And when we talk about the advanced stages of lung cancer, it is important to acknowledge there is very limited treatment options available. Smoking is the leading cause of lung cancer. Almost 85% of all cases are due to smoking. This year, the theme is not yet disclosed, but last year, the theme was very unique. A breath of prevention is better than expectation on long-term survival. So this was prepared to enhance our awareness on our breathing a good quality of air, not to breathe bad air, specifically the smoking, passive smoking. It is important to note that when we are talking about smoking, this is the greatest risk of lung cancer. Though lung cancer can also occur in pupils who have never smoked, but the risk of lung cancer increases with the length, timing, how many years, numbers of cigarettes you have smoked. But if you quit smoking, even after smoking for many years, you can significantly reduce the risk of developing lung cancer. So, better not to delay further, stop smoking. And when we are talking about symptoms, many times lung cancer not cause signs and symptoms in its earliest stage. Unfortunately, when the signs and symptoms appear, the disease is already advanced. In general, the signs and symptoms of lung cancers are a new cough that does not go away, coughing of blood, even a small amount, shortness of breath, chest pain, hoarseness of voice, losing weight without trying, bone pain, and headache. So, as we are talking about prevention, we need to know about the different risk factors. Some risk factors can be controlled, for instance, by quitting smoking. And other factors cannot be controlled, like family history. So when we talk about smoking, it is also important to note that second-hand smoke is also important risk factor for lung cancer. So when you are smoking, you are not only increasing your risk to develop lung cancer, but also you are increasing risk of others, people who are surrounding you, their chance of having lung cancer. So you are harming not only you are harming the surrounding people, the society as a whole. And when we talk now about epigenetic changes and those influences to our future generations. So with smoking, you have some epigenetic changes, and that epigenetic changes is going to damage your future generation. Those little children who had not yet came into this world, they are also susceptible to have lung cancer in future because of your smoking. So please stop your smoking. Apart from that, the other risk factors, like if you have some previous radiation therapy, exposure to radon gas, exposure to different carcinogens, asbestos, and as already we had discussed, the family history is extremely important risk factor. So how you can prevent? So there is no sure way to prevent lung cancer, but definitely you can reduce your risk if you do not smoke. If you never smoked, please don't start. Talk to your children about not smoking so that they can understand how to avoid this major risk factor for lung cancer. Begin conversations about the danger of smoking with your children early so that they know how to react to peer pressure. Stop smoking. Stop smoking now. Avoid second-hand smoke. If you live or work with a smoker, urge him or her to quit. So after that, it is not possible in India, but nowadays in US, it is recommended to test their home for radon exposure. Avoid carcinogens at work, specifically if you are in exposure to some toxic chemicals at work. Follow the employer precautions. And now after COVID, we have a mask culture now. So we can use that face mask for protection. Proper face mask, obviously. So your risk of lung damage from workplace carcinogens increase if you smoke. So there is again a contribution from the smoking also. In general, the rule is eat a diet full of fruits and vegetables. Choose healthy diet with variety of fruits, vegetables. So that is very important. It is not only you have to take large doses of vitamins in pill form, because that can be bad for you. For instance, sometimes researchers hoping to reduce the risk of lung cancer in a heavy smokers, giving them beta carotene supplements. But what happened? Results showed the supplement actually increased the risk of cancer in smokers. So be aware of that. Take natural foods, and most importantly, exercise. So exercise is very important. Nowadays, we are telling sitting is new smoking. So you stop smoking, you interrupt continuous sitting. So at least 20 to 30 minutes after, you just stand up, do some stretching, and again go back to your work. Now, finally, I want to share a very sad story with you all. One of my very old patient from 2013, I am seeing him. He is diabetic, young diabetic. Now he's only 43 years old. For 5 to 7 days, he was suffering from low back pain. By the way, his diabetes was excellently controlled. So when he was suffering from that low back pain, I had advised him to go back to one orthopedic surgeon. So they had done some MRI, and MRI suggests there is a mass in the spine. He had undergone series of tests, and ultimately it was found there is lung cancer, which was the primary cancer. And from that lung cancer, there is some metastasis, and that metastasis involved not only that spine, but also liver, adrenal gland, and now he was on some immunotherapy and chemotherapy. A few days back, I had a talk with him. He's very ill with the chemotherapy. He was not tolerating those chemotherapy, suffering from multiple episodes of infections, attack of infection. He never smoked. He never drink. He had a very good lifestyle, but he had developed this lung cancer. We know the air pollution level in this country, which may be going to increase this disease a lot, going to harm our near and dear ones. Only issue with him, he was an IT professional. So he need to do his work till 2 a.m., 3 a.m., 4 a.m., like that. And he used to get the opportunity of sleeping for maybe 4 hour, 5 hour maximum, sometimes 2 hour, 3 hours sleep, which is very unfortunate. And this type of breaking the normal sleeping pattern is a risk factor of developing any type of cancer. We doctors, IT professionals, police person, all of them are in a high risk zone because we are breaking our circadian rhythm. So we don't know, because we will not get any compensation, not get any help from our working environment if we have this type of disease. But we need to take care of ourselves. We should not break this circadian rhythm. And our regulators should think some alternative strategies to minimize harm to us, to minimize harm by having this, by reducing this disruption of circadian rhythm. We don't know what strategy we should follow, but this is happening. This 43-year-old man who had 2 small kids, unfortunately, we are going to lose. So this is the scenario. So apart from doing everything what we had advised. We need to follow the basic rules of life. We need to follow the rhythm of the nature. Thank you. Wish you all a happy, healthy life. Thank you. Thank you once again.